We're here in San Diego at the American Society of Hematology 2016, and joining me this afternoon is Dr. Lamar from the Wake Forest Medical Center. Doctor, good to see you.
Good to see you as well.
Now, I understand you're also going to be presenting some interesting data here at this conference. Is that tomorrow?
Yes, I'll be presenting tomorrow evening.
Okay, and give us a little preview of what you're going to be presenting on and some of the work you're doing at Wake Forest.
Sure, so I'm presenting an early phase 1 preliminary study of a novel drug called CPI 613 combined with bendamustine in patients with relapsed or refractory T-cell lymphomas.
Okay.
And so what we looked at patients with T-cell lymphomas, and we gave them this regimen, and what we found was that of the patients that we could evaluate, there was an overall response rate of about 80%.
Wow, very good.
Yeah.
So, you know, we talk a lot about clinical trials and the phases of clinical trials, and you said that you're presenting on phase 1?
Right.
Phase 1.
So this is a phase 1 study that has not been completed yet. It's a preliminary study. But yes, this is a phase 1 trial.
Okay, and so for our audience who are patients and caregivers and they don't really know a lot about the clinical trial process, tell us what phase 1 means.
Sure, that's a great question. So really in a phase 1 trial, what we're trying to find is the optimal dose and schedule of the drug that we're evaluating. We want to make sure that this drug is safe, and we also want to show some evidence of efficacy.
Yep. So you also had mentioned, so in your trials, you mentioned the word combination therapy. So what does that mean?
That's a good question. So combination therapy occurs when we're combining 2 drugs or more together. So my drug combines CPI 613, the new drug, with a drug that we've used before called bendamustine. Bendamustine is a drug that we know has some activity in T-cell lymphomas, but the reason why we added another drug with it is because we think that combination may be a little bit better, and we want to see if it's safe, effective, and possibly even better when combining the two.
So that's very interesting, because when we look at clinical trials, we're looking at safety,
right.
We're looking at efficacy,
right.
We're looking at side effect profiling, right? And you put all those things together, and what we're hoping to see is this new therapy is going to perform much better than what's currently the current course of treatment.
Right, so really in an early phase trial, we want to make sure it's safe and effective, and then we can study it in larger phase 2 and then phase 3 trials to really let us know if this should go to the general public to determine whether or not it's better than what we normally use now.
So we're hearing a lot of words at this conference like immunotherapy, combination therapy. It really is an exciting time to be working in the area of oncology and hematology. What do you see as on the horizon? I mean, there's so many things going on. Where do we see the most promise for patients emerging?
That's a very good question. So treatment for cancer is changing. So before, we would use drugs that would attack all cells in the body, good cells and bad cells. And a lot of those drugs were very toxic to patients. There were a lot of side effects. And as oncology treatment has gotten better, we have done a better job of finding treatments that are safer, that don't inhibit every single cell. With some of the immunotherapy drugs that are on the market that are being evaluated right now, we're really excited about that because they don't have some of the toxicities that we've seen, but really targeted therapies in general are very promising. And that is one of the reasons why there's so much interest in things like precision medicine and even more targeted therapies than what we've used in the past.